your Henry County Medical Center registered dietitian and certified diabetes care and education specialist, coming to you from Lakeway IGA here in Paris, Tennessee, to remind you that healthy diet starts right in the grocery store. We hear an awfully lot about shopping the perimeter or shopping the outside aisle. That doesn't mean that we should only shop the outside aisle, because rules are meant to be broken. So if we can always find some unhealthy choices in the perimeter, but we can also find some healthy choices in the inside aisles. So a great goal for our shopping would be to fill about 75% of our carts with the healthiest choices from the outside aisles, and about 25% of our carts with the healthiest choices from the inner aisles. That can be things like olive oil and beans and things like that we find on our inner aisles. And of course, produce and our healthy protein choices like mixed eggs and cheeses that we find in our outside aisles. Most grocery stores are set up about like the one that I'm in, where produce is the first section you encounter when you walk into the store. So that's a great place to start making good, healthy choices. Dietitians are known to encourage their patients and clients to eat more vegetables. And why is that? Well, the reasons are countless, but we're going to review just a few today. People who eat more fruits and vegetables tend to have less chronic diseases and tend to have an easier time managing their weight. There's lots of vitamins and minerals that we get specifically from fruits and vegetables, more so than any other food groups. So let's talk about just a few of those today. Vegetables are an important source of many nutrients, including potassium, dietary fiber, folate, vitamin A, and vitamin C. So why are those so important? Well, diets rich in potassium can help to manage hypertension. They can also prevent the development of kidney stones and prevent bone loss. Vegetable sources of potassium include beans like lentils, white beans, pinto beans, as well as many of our greens. We also have rich sources of potassium in our fruits like oranges and bananas. Dietary fiber from vegetables as part of an overall healthy diet may reduce the risk for heart disease. Dietary fiber is also important for bowel health with the prevention of constipation and diverticulosis. Fiber also helps us to feel fuller longer and can be an important nutrient for weight management. Diets rich in foods containing fiber, including vegetables and some fruits, may prevent the development of type 2 diabetes. Folic acid helps the body to form red blood cells. We hear most about the importance of folic acid for women of childbearing age, but we need to all remember that folic acid is a nutrient of concern to help keep our bodies healthy and producing plenty of red blood cells. We find folate in enriched foods in the form of folic acid, which is synthetic, but also in its natural form of folate is in our dark green vegetables like broccoli, spinach, asparagus, and also in avocados. Vitamin A helps keep skin and eyes healthy and prevents infections. We tend to find vitamin A in our orange fruits and vegetables. So think about carrots, sweet potatoes, and cantaloupe as sources of vitamin A. Vitamin C is important for gum health and wound healing. We find vitamin C, of course, in our citrus fruits, but also in many vegetables as well, like peppers. Vitamin C aids in iron absorption, so it's very important to remember that if you've ever had iron deficiency anemia or taken iron supplement for any reason, you want to think about taking that with a vitamin C rich food, like eating an orange when you take your supplement, or a grapefruit, or drinking a little orange juice, or taking it with something that contains tomatoes. We're still in the outside aisle of our grocery store, this time in the egg section. In a very recent publication from the Advisory Committee for Dietary Guidelines, the committee recognized eggs as an important first food for babies and toddlers. They also recommended increased egg consumption for pregnant and lactating women. And the main reason for that is because of the nutrient choline, which eggs are an excellent source of. So choline is important for brain development as well as maintenance of brain health. So go ahead and eat those eggs every day if you like. A recent publication from Harvard reminds us that dietary cholesterol is not a nutrient of concern for eggs. They looked at the past 30 years of research on cholesterol and heart health, specifically on eggs, and determined that increased consumption of eggs does not increase risk for cardiovascular disease. So we're in the meat section, and as a reminder, when you choose ground meat products, there are two numbers on there and they tell you exactly what you're getting. So like 93.7 or 90.10, those are good lean sources of protein. So the leaner you can afford, the better off you're gonna be. Red meats are great with lots of iron. Remember to eat them with a good vitamin C source like peppers, or chicken is always a great lean protein, as well as fish. We've stepped into an inner aisle to pick up some healthy fats or oils. So I have extra virgin olive oil here, and extra virgin just refers to the first press, as in the olives are pressed and that's the first oil that we get. So a light olive oil does not refer to any difference in nutrition, it's just a lighter taste. If you can find it, you want your olive oil in a opaque or tinted container like this one, like this bottle, because light and exposure to air both degrade the quality of your olive oil. So if you can find it in a tinted bottle, that's always a better choice for more bang for your buck, and it should last a little longer in your cupboard. We've come to another inside aisle to make healthy choices here as well. So we're talking about beans. So your dried beans can be an excellent resource for stretching your food dollar, and they tend to be fairly inexpensive and can go a long way. Remember that if you do choose a canned bean, you preferably want to choose those with no salt added. So beans can be easy to add to even to a salad. If you rinse off a canned bean and add it to a salad for your protein source. Excellent source of fiber, again, that can help with prevention of cardiovascular disease and promote bowel health and all those great things that fiber does. We're back in the outside aisle choosing healthy grains. We want to remember to make most of our grains whole grains, and so we want to look for on the label 100% either whole grain or whole wheat. Any bread can be called whole wheat bread if it has any whole wheat fiber at all. So remember that 100% is important to look for on that label to know that you're getting all of the grains in that bread as whole grains. Thanks for coming along on our virtual grocery store tour today. Hope you enjoyed it. If you have any nutritional related diagnoses that you need help with the nutritional management of, please have your primary care physician refer you to me, Kim Dempsey, registered dietitian with Henry County Medical Center. That referral can be faxed to 731-644-8488.